The anticipated nationwide rollout of Starlink's satellite internet service across Papua New Guinea is expected to fundamentally transform healthcare delivery, with experts identifying telemedicine as a critical tool for bridging access gaps in the country's most isolated communities. That promise is already being put to the test in Morobe province, where a pilot telemedicine initiative based at Indagen Health Centre in Kabwum district has demonstrated that reliable connectivity can mean the difference between life and death. A recent emergency at the centre offered a compelling example. A patient arrived late at night suffering from a deep laceration to the chest, with the wound exposing the lung. With no doctor on site and no possibility of evacuation until morning, the situation appeared dire. Dr. Simon Ganal, founder of the Katim Tasol Foundation, guided the facility's officer in charge, Kathy Nassim, through the complex procedure remotely, step by step. Through telemedicine, it was possible to guide the team to identify it as an open lung injury, Dr. Ganal told reporters. We were able to go through the pleura, muscle and fascia layers together and guide them step by step to stop the bleeding. Ms. Nassim successfully performed the procedure, stabilizing the patient throughout the night. The patient survived and was transferred the following day to Ganal Memorial Hospital via Mama Medivac for further specialized treatment. Dr. Ganal said the case underscored the vital role telemedicine could play in strengthening frontline healthcare, especially in regions where access to doctors and medical transport remains severely limited. However, the nascent system has faced technical hurdles. Captain Jürgen Rue, Chief Executive Officer of Manolos Aviation, confirmed that Starlink had been installed in Indagen. However, early connectivity challenges briefly disrupted the service shortly after its first major test. We have actually installed Starlink in Indagen. The case that Dr. Ganal presented, a chest cut all the way to the lungs, he gave telemedicine, we picked up the patient the next day, and then Starlink was cut off. He acknowledged the assistance of Bougainville Regional Member Peter Tsiamalili Jr., who was serving as Acting Minister for Information and Communications at the time, to help restore and secure the service. We have fought hard and we got it. Hopefully Starlink should be online soon, Captain Rue added. Captain Rue emphasized that reliable connectivity would eliminate long-standing communication barriers that rural health workers face daily. There will be no more blackouts. There will be no more climbing trees to make a phone call. There will be no more climbing mountains to make a phone call. There will be no more delays of 1 or 2 days to get the message out that we need help. With proper communication, doctors will be able to assess cases, determine whether a medivac is needed or not, and manage the level of evacuations much better.